what your wishes would be, or your older loved ones' wishes would be in those situations. So based on my survey results that I just posted about DNR, they were not too surprising based on my audience. I think an overwhelming majority of my followers are in healthcare, so that makes sense that most people would know what full code and DNR means. Also, a majority of my audience are young and healthy, so it makes sense that everyone would want to be a full code except one person who is an oncology provider. Makes sense, DNR. Anyways, and then I was surprised by how many of you have already had a conversation about what your older loved ones would want, so that's awesome. So the reason that I get passionate about full code versus do not resuscitate is because what exactly full code means and who it originally was made for. So what code status means is if someone walked in on you and you were essentially dead, if you had no pulse and you weren't breathing, would you want us to try to bring you back to life by pushing on your chest, potentially shocking your heart, and putting a breathing tube down your throat and putting you on life support in the ICU? You guys remember when that football player was coded on the field and they were able to bring him back and he was able to fully recover? Those type of situations are what CPR was made for. It was originally made to help people who essentially die or have their heart stop or stop breathing who are otherwise healthy. In those patient populations, CPR has a much higher likelihood of working and you having a meaningful life afterwards. But so often in the hospital when I admit patients, a lot of times they have cancer that is spread throughout their whole body. They also have other comorbidities such as maybe pneumonia, heart failure, diabetes, chronic kidney disease. They are not healthy otherwise. And when you code someone who perform CPR on someone who has other significant comorbidities such as cancer spread throughout their body, it has a very low likelihood of, one, you surviving, and two, if you do survive, what is your quality of life going to be in the ICU? Most likely, your family will decide to withdraw care. That's the most likely situation. And so I get passionate about this because no one wants to be coded in those situations. It's not. So if one of my patients has cancer throughout their body, but they're in their 40s, they have a young family, they want to be full code, sure. Obviously, no matter what, it's the patient's decision, no matter what. But sometimes if you have a 70-year-old, 80-year-old patient even who has cancer spread throughout their body, sometimes I do like to talk about what actually that code situation would be to make sure that the patient fully understands, because I think a lot of times people don't. They just say, yes, bring me back, I want to survive, but I always want to let them know what that bringing back would be. And unfortunately, a lot of times when you are a full code, if you do get coded and you're in the ICU and really, really sick, because usually you're very, very sick, that would lead to you to have to stop breathing and for your heart to stop. It doesn't just happen spontaneously. There's something bad going on in your body for that to occur. So you're in the ICU, and then instead of you deciding to be a DNR prior to this, it's your family that decides to say, let's take mom or dad off life support. They have to make that decision, which is often very, very hard. So I hope I painted a better picture of what choosing full code versus DNR means in the hospital when you're really, really sick. Something that's, terminal, not something you can get over. Because it's a decision you should think about or before you're in that situation. So if you have any questions, let me know. Actually, I guess I didn't talk about what it means if you're DNR. So that means do not resuscitate, do not intubate. And what that means was if your nurse walked in and you weren't breathing and you had no heartbeat, then we would not do anything. You would just pass away peacefully. We would call your family if they weren't there. And that's that. It doesn't mean that we don't do everything else leading up to that moment that you're not breathing or no pulse. We do everything else possible to help you when you're sick. It's not hospice, but it just means if you die, then you die. And we don't push on your chest, we don't put a breathing tube down, you don't go to the ICU. Which often that is the much, much, much more peaceful alternative. So maybe you want to know what the answer to my questions are. Right now, I would be a full code. If I got metastatic cancer diagnosed tomorrow, I would be a DNR.